This has been a tough year for educators navigating the ever-changing pandemic. Districts scrambling to close down and then open back up again. Mask mandates, virtual learning, vaccines. It has not been easy. But now one Florida school district has been blindsided by tragedy. So it now has a new focus on mental health. And this story is not about helping students cope. It's about helping its staff of adults. Here's I-Team reporter Katie LaGrone.
Tucked in the middle of the state, amid fields, farms, and the lake that bears its name, is Okeechobee County, population just over 42,000.
We're a small community. Everybody knows everybody.
Here, the county school district is the area's largest employer with nearly 900 employees. It's also among the most personal.
We know our people know us.
Dylan Tetters is a former high school principal here, now the district's second in charge.
Most of them probably have our cell phone numbers.
So in October, when a longtime school district director died by suicide,
It's a shock to our community.
less than 1 month later, a school guidance counselor.
When you look at it just simply on paper, you say, okay, what is going on?
And then, just about a week and a half ago, came the news about a district math teacher,
Yep.
beloved by so many.
It's tough. Tough.
3 school employees who died by suicide within just 10 months.
I hadn't experienced anything like that happening before, and this is my 25th year in this district.
It's not known if work-related pressures contributed to these losses. Experts say suicide is not a common reaction to adversity or mental illness. But for this rural school district, the passing of 3 valued school employees to suicide has inspired a new focus.
We felt like we had a good system in place to identify students in need. I mean, it's a requirement now, but there wasn't a requirement for adults. So we needed to be able to provide that avenue.
And one that could be completely anonymous, so beyond what's offered through HR or insurance. Since December, the district has outsourced a staff-only psychologist at no charge to employees. There's also a monthly health and wellness menu with offerings such as skateboarding, a book club, yoga. Divorce counseling is coming soon.
One would never think that this is now up to a district to offer.
But why wouldn't we? Ultimately, we have to educate students. But if our staff is not healthy, are we educating our students to the full potential?
National surveys show in the last year since the pandemic, teacher stress and anxiety has soared, with morale plummeting.
This has been a very stressful year and a half.
The president of Florida School Superintendents Association hadn't heard about the losses in Okeechobee County, but acknowledged the need for mental health services for school staff statewide. While millions in state funding has focused on beefing up district mental health services for students, it's unclear if any of that money can also be used to support school staff. Back in Okeechobee County,
When you bring on a psychologist, it's not free.
community partners are helping to pay for some of the additional expenses. The district is covering the rest, with no plans to stop.
If we really want to take care of the students, we know we have to take care of the staff. If we've even saved one, it's worth it.
We reached out to the state education department to find out about money for staff mental health services, but have yet to hear anything back. I'm I-Team investigator Katie LaGrone, taking action for you.
Katie, thank you. If you or someone you know is looking for help, please reach out to the National Suicide Prevention Lifeline. That number is 1-800-273-8255.